Hey there, welcome back to How to Medicate and welcome to this new video on how to treat and possibly improve a narcissistic personality disorder. This video is part of a video series on mental health problems, and for those of you who want to keep on learning, check out the playlist in the description after watching this video, of course. Now, for those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel and this video. This video also comes with a quick disclaimer. It's meant purely informative, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's start learning. So in this video, as promised, we will cover how to treat a narcissistic personality disorder. But before we do so, I thought it would be important to exactly explain what a narcissistic personality disorder is. First of all, as the name suggests, it's a personality disorder. As a mental illness, it's characterized by exaggerated feelings of self-importance, craving for admiration, and a lack of empathy. Patients with a narcissistic personality disorder spend a lot of time daydreaming about themselves achieving power or success. Other symptoms may be a fragile ego, a tendency to belittle other people, and an intolerance of criticism. Now, narcissistic personality disorder is quite rare, as about 0.5 to 1% of the general population has it, and of this population about 50 to 75% are men. Then it's still unclear how a narcissistic personality disorder is caused. However, it is believed to be caused by a combination of factors. Biological ones, like a genetic predisposition, psychological factors, like growing up in an unstable household or experiencing trauma, and social factors, like being born in the Western world, where narcissism is more common. Lastly, a narcissistic personality disorder is associated with other mental health conditions like a depression, bipolar disorder, substance abuse, and other personality disorders. Which brings us to the possible treatments. And here I want to mention that the effectiveness of psychotherapy and the usage of drugs in the treatment of a narcissistic personality disorder has not yet been intensively investigated. The current treatment recommendation is largely based on theoretical models and the experience of clinicians and psychiatrists worldwide. Furthermore, patients with a narcissistic personality disorder rarely seek mental health treatment primarily for the personality disorder. They usually seek relief from other mental health disorders like a major depression or substance abuse. Only when treatment for these conditions is started, the narcissistic personality disorder comes to light as the underlying problem. Then, if you would want to start treatment for a narcissistic personality disorder, there is little place for the usage of psychiatric medication. However, they can be used to treat symptoms of other mental health disorders. As an example, a co-occurrent depression can be treated with antidepressants, and a co-occurrent anxiety disorder can be treated with anxiety medication. However, as of this moment, the most suitable treatment option for a narcissistic personality disorder is the usage of psychotherapy, and there are a few different forms which can be helpful. We will discuss cognitive behavioral therapy, dialectic behavioral therapy, schema therapy, and EMDR. Now, it might be no surprise that the behavioral therapies like cognitive behavioral therapy or dialectic behavioral therapy focus on the behavior of a patient. In this form of therapy, difficult events out of normal daily life are practiced, so a patient can learn to cope with these events. This then could lead to new positive experiences. Next up is schema therapy. This focuses on helping patients identify and understand patterns and coping mechanisms, which they establish from their early childhood, to then modify and change their behavior towards others. Lastly, EMDR. EMDR therapy is a step-by-step treatment. It addresses negative memories, traumatic events, and emotional triggers. It's best that you would discuss these treatment options with your psychiatrist or your treating physician to identify the most suitable one for yourself. Now, I hope this video was helpful, but if you have any questions, let me know in the comment section below, and I will do my best to answer all of your questions. For those of you that want to keep on learning, check out the playlist in the description down there, or I'll put it up there. Now, before you go, please leave a like. This will help out the channel tremendously, and consider subscribing so you never miss such an awesome video again. Only about 1% of my viewers is subscribed, and I think we can do a whole lot better than that. Thank you all for watching, and as always, I will see you next week with a new video. Bye bye.